Thousands of Georgians could soon be forced to find a new doctor.
A local hospital system and insurance provider at odds over your coverage, and this time is running out with year-end deadline looming. And if Northside Hospital and Anthem Blue Cross Blue Shield cannot find common ground, patients will be out of luck starting January 1st.
And while contract disputes are not new, CBS 46 investigative reporter Rachel Polanski finds they are becoming more common and impacting accessibility to your health care. Rachel, this is really becoming a problem.
It really is, and this is just one of those Northside Hospital locations that will be impacted if these negotiations don't go through. Now, I talked with the mother of a sick child, and she has to go to the hospital fairly regularly. And she says if they cannot come to an agreement and quick, she'll have to, 1, drive a lot further for care, or 2, pay a lot bigger out-of-pocket expenses. Behind all of this is a little kid with a really big heart.
I'm proud of him.
And a supportive mom.
So, he's come so far.
We know the story of this guy's heart.
What's the Grinch?
2 sizes too small. Mason's heart, it's a little bit different.
HLHS, as we call it. When you're born with half a heart.
He was born with a congenital heart defect called hyperplastic left heart syndrome.
So he had to have a series of heart surgeries.
The 10-year-old relies on the doctors at Northside Forsyth. That's why his mom, Tanya, was outraged when she found out her insurance company and hospital couldn't see eye to eye.
They told me that as of December 31st, that they would be out of network and they would no longer be taking the insurance.
And the Langs are part of 400,000 Georgians who will have to find new providers if Northside Hospital Systems and Anthem Blue Cross Blue Shield do not come to an agreement by the end of the month. Now comes the finger pointing. As Northside tells CBS 46 investigates, this decision surprised us. Our agreements with Anthem were not up for renewal and were not set to expire. Meanwhile, Anthem Blue Cross Blue Shield said Northside is one of the most expensive systems in Georgia, and the current contract does not adequately align incentives to improve quality and affordability for our members.
We've yet to see costs go down for consumers when hospitals merge. What happens when there's less competition? Always happens.
Members. Liz Coyle, who heads consumer advocacy agency Georgia Watch, says we're seeing contract disagreements like this all over the country, and she blames it on 2 things. 1, consolidation of the marketplace. That's when we see mergers involving 2 major companies that provide similar services. And 2, inadequate network standards. That's when your insurance plan does not give you enough access to providers in your area. Coyle goes as far as saying that just like surprise billing, this is the new issue in the healthcare debate. And the only way to fix it is the same way we fix that, through legislation.
Something like that needs to happen in this case. That disagreement should not leave 400,000 people without access to their trusted provider or needing to travel a long distance to get a network care.
Care that for those like Mason Lang can mean life or death.
To think that you're throwing people's lives up in the air over dollars, it just infuriates me to no end.
And now hundreds of thousands of patients like Tanya and Mason are waiting. And Sean and Rick, that agreement, that deadline is coming up. It is December 31st.
And Rachel, is there any hope, though, that Northside and Anthem Blue Cross Blue Shield will meet that deadline?
Now it's possible. I was doing some research, and in Oklahoma, Blue Cross Blue Shield and a health system there did reach an agreement in the 11th hour, so we will be watching that, and of course we will bring updates as we learn them. Reporting live tonight, I'm Rachel Polanski, CBS 46 News.
Rachel, thank you. And if there's something you would like our team to investigate, email us at investigates@cbs46.com.